This is Tom with Medical Missions Outreach. I work with dental clinics and everything related to dental. So today I wanted to talk to you guys about the sterilization of the utensils that we're bringing on the mission trips. And we have an exciting new piece of equipment to add to our arsenal this year. And of course, anyone working with dentistry understands, we're working right in people's faces. So infection control can be an issue, especially when you're not in the comforts of your dental practice here in the United States. So in order to prevent diseases and infections from being transmitted, not only do we wear masks and gloves, but we also need to sterilize our equipment. And that's important to both our patients and the practitioners alike. We don't want to be spreading diseases or any type of infection someone might have between one patient to the next. We never want to leave people worse off than they were when we first got to see them, but we also want to protect our staff from getting any sicknesses as well. Standards of care in the United States and other countries can be vastly different, and we want to abide by United States standards of care as best we can. So that calls for hot sterilization. There are a lot of cold sterilization techniques that are used in other areas of the world, and some of these are more or less effective than others. Bleach is an option, but of course we know how bleach can be very damaging to instruments, especially metal instruments, and other options are rapicide, but it still doesn't give us the full effect that we really want to protect both our patients and the practitioners. So this year, we're very excited to add an autoclave to our list of equipment. An autoclave works by putting intense heat and pressure on previously somewhat cleaned instruments, so it will disinfect and sterilize whatever might be left on there. So the next patient that is seen with this same utensils will be perfectly safe from that. This year, Medical Missions Outreach was able to add the Statum 2000 autoclave to our arsenal of dental equipment, and we're really excited about that. It's technically not a portable autoclave, but it's portable enough because it only weighs 46 pounds. So from what we understand is the lightest autoclave that is out there and available for use. And of course, that's without water added, but we add that when we get there and we take it out. Another important factor about this autoclave is the cycle duration. Unwrapped instruments will cycle through the autoclave in approximately 6 minutes with 3.5 minutes of sterilization. If we get to the point where we might wrap some instruments towards the end of a trip, that increases to about 14 minutes total with 10 minutes of sterilization, but that might or might not be something we end up doing. In order to use the autoclave, a couple steps need to happen first. And of course, since it is an autoclave, the first thing we're going to need to do is obtain a power source and plug it in. Next, we need to find as level of an area as we can. It doesn't have to be perfect because the autoclave does have some adjustable legs that allow us to level it out. And the icon on the machine will actually tell us when it is not level and when it is level. So once we get that adjusted and in place, we can move on to connecting the waste bottle. Connecting the waste bottle to the back of the machine is a simple task of just using some plastic tubing and connecting it to a nozzle on the back. This is accomplished by inserting the tubing through this metal nozzle and pulling the nozzle out, making sure it's securely attached. The bottom part of this tubing is going to be attached to the top part of the waste bucket. That gets screwed in. Again, make sure it's secure. And then the lid of the waste bucket with a coil will get screwed into the waste bucket itself, which is best accomplished by actually screwing the bucket part. What you see is a little bit excess tubing. We're going to want it to run straight from the machine down into the waste bucket, but until we're on site, I don't want to cut any of the tubing to the right length just yet. There is a minimum amount of water needed in the bottom of the waste bucket in order for the whole thing to function properly. You can see written down there on the bottom, it says minimum amount. So we'll always start with that and keep it at that level no matter how many times we need to empty it along the way. Once everything is connected to the autoclave, we can go ahead and fill it up with water. We do this by simply opening up the reservoir and using distilled water only. It's important to only use distilled water so we don't have buildup of minerals inside as the steam exits this machine. We fill up to approximately 1 gallon of water at a time, and then we have to prime it as well. Priming it is done by lifting the machine up at the edge of a table. There's a small hose underneath, and all we need to do is take the cork out of the end of that hose, hold it down for a little while, have something that we can drain some water in, and we want that water to drain for a good solid 30 seconds in order to make sure the machine is primed. And then we're ready to start our preparation cycles. The machine needs to do 2 wrapped preparation cycles in order to warm up right and function properly. These are the longer cycles I mentioned a little while ago. And once these 2 cycles are over, we're ready to go for the rest of the day. It's best if we probably start this at the very beginning of clinic, so by the time we seen our first patients and are needing some equipment to be sterilized for our next patients, we'll be ready to go. Once we finally get to the point where we are needing to sterilize instruments, as the dentists are using them and the hygienists are using them, we're going to go ahead and open up the cassette, which is what holds the instruments inside the autoclave. It can be a little tricky to do. You have to hold it in two hands and push down and let the bottom part of it kind of fall underneath rather than lifting the top off. And in order to sterilize the equipment, it needs to be placed and spaced appropriately inside of this cassette. With doing that, we don't want things touching each other, crossing over, just to make sure each surface of each instrument is getting hit by this pressurized steam to make sure everything is getting perfectly sterilized. We go ahead then and shut the cassette again and stick it into the machine. And once it's snugly in place, it'll click in, and then we go to choosing which cycle we're going to do. Since we're going to be turning out a lot of instruments and using them pretty soon after sterilizing them, the quickest and most efficient way of doing this is choosing the cycle that is unwrapped. After about 6 minutes of running time, it is time to unload the cassette out of the autoclave, and that's just simply done by pulling it out. It'll click out of place, but we need to keep in mind that the metal on this part of the machine is going to be extremely hot, so we have to carefully take it out. If the metal is going to be handled, we need to handle it with some type of heat pad and put it in a safe place so it can quickly cool and be ready for the next hygienist or dentist to use. At the end of clinics on the last day of clinics for the trip, the major thing we'll have to do is just drain the reservoir of whatever distilled water might be left over from using the autoclave all week, and that is easily accomplished by going back to that tube underneath that we looked at just a little while ago and just letting the water drain into a bucket of some sort so we can just dump it out, just clean distilled water. The rest of the maintenance on the machine can easily be done when we get back to the United States. Thanks for checking out the video. We look forward to getting back out in the field with you guys sometime soon.